and gentlemen, good evening and welcome to Ask the Doctor, live on CNC3 on Thursdays. But if you miss us, don't worry. Our core presentations air on Friday at 11 a.m. and Saturday at 11:30 in the morning, right here on CNC3. You can also catch us streaming on Facebook and the CNC3 website, because good health should never be out of reach. And every Friday in the Trinidad Guardian, my Ask the Doctor column shines a light on the issues that matter most to you and your family. We say that every heartbeat tells a story, every cough hides a clue, and every patient reminds us that medicine isn't just about science, it's about people. And on this show, we decode the mysteries of the body, shine light into the shadows of disease, and remind you that health isn't just the absence of illness, it's the presence of hope. Let's start with the doctor's capsule. November is Diabetes Awareness Month, and the theme of World Diabetes Day on the 14th of November is diabetes and well-being, as the spotlight shifts to the workplace. 100 years after the first insulin injection, can you believe there are millions who cannot afford optimal care? It's not enough to just put out statements about awareness while people with diabetes are being failed every day. So that blue circle is used as an icon for World Diabetes Day as we try to unite against this scourge. Now, if we truly care about this chronic disease, it's time to show it. The resources to transform lives and prevent suffering exist. But what's lacking is the will to prioritize them. There are now over 550 million people worldwide living with diabetes, and it's been estimated that 1 in 2 persons would be unaware that they have it. The disease quietly damages the eyes, kidneys, nerves, heart, and mind, often for years before diagnosis. And in Trinidad and Tobago, the situation mirrors the global crisis. Limited access to affordable medications, erratic monitoring, we talk about the so-called CGM or continuous glucose monitors, and a growing tide of obesity that fuel what can only be called a diabetes tsunami. And we'll shine the spotlight a little on this chronic illness because diabetes is a disorder of elevated blood sugar. Most persons would have resistance to insulin, so the body is unable to use insulin properly, that's type 2, or you may have a deficiency of insulin, type 1. Some women develop gestational diabetes during pregnancy, and we know that rare genetic forms also exist. So not everyone fits into these little holes. In the 1950s, a British doctor, Philip Hugh Jones, working in Jamaica, noticed something strange. Last month, I spoke about an article in The Lancet in which 13 of his patients with diabetes didn't fit these usual groups of type 1 or type 2. They were young, they were thin and undernourished. But unlike the classic sort of type 1, you know, that younger patient, less than 30, who require injections of insulin, they never developed a complication called diabetic ketoacidosis. So the doctor called it type J diabetes for Jamaica. 70 years later, researchers believe that he was onto something. It's an unusual form of diabetes linked to lifelong malnutrition. So it's something to consider in the region because it's being recognized internationally as type 5 diabetes. So unlike type 1, where no insulin is made, or type 2, where, as I said, most of the patients would be insulin resistant initially, people with type 5 can make some insulin, but not enough, because their pancreas never fully developed. The BBC reported that persons with type 1 diabetes have immune-mediated destruction of the pancreas because it's thought that there is improper development at younger ages. But type 5 linked to malnutrition, and standard treatment with high-dose insulin may actually be deadly if patients don't have enough food to eat. So while genetics play a role, it's our environment that lights the match. So think about genetics like a loaded gun, and lifestyle pulls the trigger. Central obesity, that telltale ring of fat around the waist, or the darkening to the neck and knuckles, tend to be markers of insulin resistance. And a modern diet in the West Indies tends to be rich in refined carbs and sugary drinks, but poor in fiber and movement. We've become spectators rather than players, and that has set the stage for disaster. We're seeing younger people with type 2 diabetes. It's been likened to a car crash in slow motion. So who's at risk for diabetes? If you're 40 years or older, although younger persons are being diagnosed daily, we're seeing type 2 diabetes in even school-aged children. If you have a family history of diabetes, based on your ethnicity, if you're an Afro or Indo-Trinidadian or Hispanic heritage, past gestational diabetes, or you've had large babies or recurrent miscarriages, if you've had high blood pressure or high cholesterol, younger persons with polycystic ovaries. We mentioned that darkened skin around the neck as a telltale sign of insulin resistance. The term is acanthosis nigricans. And diabetes often hides until complications emerge. Subtle blood sugar abnormalities may smolder for up to 20 years before the diagnosis, and that's a silent countdown to catastrophe. How to spot the signs: constant thirst and urination, blurred vision, fatigue or weight loss, numbness or pins and needles in hands and feet, and frequent infections because there is a reduced level of immunity, so you're thus more susceptible. The diagnosis of diabetes requires blood tests, so not just guesswork, because many persons, particularly in the early stages, may be asymptomatic, have no classic features. So if your fasting sugar level is greater than or equal to 126 milligrams per deciliter, if your hemoglobin A1C exceeds 6.5%, so that looks at your blood sugar for the last 3 months, we're thinking about diabetes. You might want to confirm it on a subsequent occasion. If you have a fasting blood sugar level which exceeds 126, and 2 hours later, if you do a glucose drink, 75 grams of glucose, and is greater than or equal to 200 milligrams per deciliter, that's also a clue. If you have signs and symptoms of diabetes like the thirst, the urination, weight loss, blurred vision and frequent infections, and a random sugar exceeds 200, there's trouble ahead. And what about pre-diabetes? It's almost like you're standing on the threshold of this chronic problem. It lurks between a fasting level of 100 to 125 milligrams per deciliter fasting. Or that test, the hemoglobin A1C. Talk to your doctor about the HbA1c. That's your blood sugar control for the preceding 3 months, 5.7 to 6.4% pre-diabetes. Now, it's important to emphasize that people with diabetes can live full, vibrant lives, but only through consistent care. Complex carbohydrates are not enemies. We're talking about a judicious amount of fruits, vegetables, beans, and whole grains to provide steady energy. Portion control matters. Perhaps a handful of rice, a palm-sized piece of meat, and avoiding sweet drinks and limiting alcohol. You could never go wrong with water as your beverage of choice. 30 to 60 minutes of exercise for most days in the week to reduce your blood sugar, your blood pressure, cholesterol, and improve features of depression. What about monitoring? Regular finger stick tests, and discuss about this device called a CGM, or continuous glucose monitor. And we spoke about a hemoglobin A1C. It's time to get that out as your marker. That is your clue for blood sugar control over the 3 to 6 months. And annual eye, dental, and foot checks. Now, what about low blood sugar? If it's dipping below 70 milligrams per deciliter, that's also a medical emergency. If you're older, frail, with a limited life expectancy, low blood sugars are worse than if they're a bit high. They may be caused by missed meals or medication errors. Some of the symptoms include sweating, trembling, anxiety, and confusion. A small sweet drink or glucose tablets may save a life. And never drive or operate machinery if unwell. Depression and anxiety stalk those with chronic disease. doubling their risk of death, and mental health support should be part of every diabetes clinic. Because when you ignore it, it just turns treatment into mere numbers. It's not lotto or playway. It's not a matter of arithmetic. Because without humanity, diabetes management will suffer. We need resources, sure, insulin, blood tests, clinic visits, education, and access to healthy food. But yet for many across Trinidad and Tobago, on World Diabetes Day, these remain out of reach. November 13th is World Kindness Day. Maybe it's time we start practicing kindness to those around us. Imagine being told you need daily insulin and realizing that you simply can't afford newer formulations or pens. The cost of survival shouldn't depend on your payslip. The result means that certain people will enjoy cutting-edge therapies and regular specialist reviews, while the poor will ration doses or skip treatment entirely. Can you imagine in Trinidad and Tobago, there are persons who cannot take insulin because they don't have a fridge? There are people who had to ration insulin at some point a few months back because there was actually a shortage on CDAP. Insulin rationing, a silent crisis. It's not a failure of personal responsibility. That's a symptom of healthcare inequality. And diabetes is an example of this in the world, because modern diabetes care has advanced rapidly. There are medications like those injectables once a week called GLP receptor agonists, and some drugs that help excretion of sugar in the urine. They don't just control your blood glucose. They reduce heart and kidney complications and even help with weight loss. But for many local patients, these breakthroughs might as well exist on another planet. There are price tags, procurement gaps, and policy inertia that keep them locked behind pharmacy counters. So the science of hope exists, but what's missing is the political will to deliver it. Managing diabetes isn't just about medications. I think in this monologue you'll realize it's about meals, but try finding fresh produce in some of our communities that's actually affordable. Fast food chains thrive while fruits and vegetables are scarce. We tell patients, don't you just go and eat better? But for many, better simply isn't available or affordable. And that's the cruel irony of diabetes care. We preach discipline to the undisciplined while ignoring the environment that shapes their choices. And true public health reforms will start not only in hospitals, but in supermarkets and school canteens. Diabetes education is the cheapest medicine we have and the least prescribed. Far too many patients leave clinics without truly understanding what diabetes is, how insulin works, or why regular monitoring matters. So education empowers, but ignorance endangers. We spend millions treating amputations, blindness, kidney failure, and cardiac complications, yet underinvest in preventing them. A single hour with a diabetes educator can save years of suffering. Women with diabetes often face unique hurdles, from pregnancy complications to hormonal fluctuations and mental health burdens. In many families, women are caregivers first and patients second, sacrificing their own health for their loved ones. And I want to salute the women with diabetes and the matriarchs in our families. What about sugar-sweetened beverages? Barbados did it, Mexico did it. They taxed these drinks, reduced consumption and slowed obesity rates. We've heard about taxing cigarettes and alcohol. Why not tax soft drinks, sugar-sweetened beverages? It's one of the simplest, most effective public health interventions imaginable. And why not here? You're going to hear about politics, you're going to hear about profits, There will be big debates in Parliament. The politicians will want to tell you how to look after your health. And profits are still more powerful than prevention. But a sugar tax would send a clear message that our government values citizens' health more than corporate gain. I want to congratulate our nation's Diabetes Association that continues to do extraordinary work, filling the gaps. They offer screenings, education, and hope where the system has failed. Their quiet heroism has been recognized nationally, but they can't do it alone. World Diabetes Day should be a reckoning, a time when policymakers confront the uncomfortable truth. Our system fails the very people it claims to serve. Diabetes doesn't discriminate, but healthcare does. If we are serious about well-being, it's time to build a system where the poor won't pay with their lives for the privilege of being sick. It's time for a short break, and when we return, there'll be more on Ask the Doctor. Stay with us.
Fence Trinidad and Tobago, your #1 choice for furniture, electronics, appliances, and parts. With the best prices guaranteed, there's no better place to shop. From exercise equipment to garden supplies, general office furniture, and so much more. Fence has it all under one roof. Call us today at 650-FENS. That's 650-3367. Or visit us at 1 Union Road, Marabella. Fence of Trinidad and Tobago. Quality, value, and variety you can trust.
With the cold and flu lurking around every corner, keeping your immune system strong allows you to live the life that you want every day. Discover BioStrath Immune Health. BioStrath Immune Health is a unique plasmalized yeast product that enhances the absorption of essential micronutrients, ensuring that your body stays resilient. And now enriched with zinc, it is your go-to support for immunity. Staying vibrant and healthy just became a whole lot easier. BioStrath Immune Health. Get what you need naturally.
It's a beautiful day at the Oval. And opening the bowling from the Palm Grove end is Sean Bishop. And here he comes charging in. Right arm over the wicket. Powell takes a huge swing. Richardson is under it. Whoa! That was a spectacular catch. Big things ahead for this new crop of youngsters. The future is bright.
Win a brand new ride for Christmas in a 3-car raffle organized on behalf of Queens Royal College. Merry Christmas! First prize is a luxurious, fully loaded big ride Ford Ranger. Draw date Saturday, December 20th at the school. Tickets only $100. All proceeds for the further uplifting of the school. Tickets available from teachers, parents, alumni, and of the school. Also nationwide at all branches of True Value, Reliable Appliances, Christina Shoe Store, Kenny Sports, Unique Bookstore, Extra Foods, JTA Supermarkets, Police Credit Union, ABC Home Center, The Trinity Shop, PRW Enterprises, Charon Bookstores, Miguel Moses and Sons, Ishmael Khan and Sons, Modern Electrical, Crosby St. James, Attorleys by the Park, Tribe, Mass Carnival, Cinnamon Drugs Sangre Grande, Bellini Drugs San Fernando, Ronnie and Carol Maraval Road, IslandEtickets.com. For more info, call the college at 622-1671 or the hotline at 491-1802. Queens Royal College 3-car raffle.
Welcome back to CNC3's Ask the Doctor. In this fan-favorite segment, we talk about staying healthy, strong, and full of giggles. From brushing your teeth to eating your veggies, to knowing when to rest and how to be kind. Because every dream starts with a healthy little body. Feel free to send videos of school-aged children discussing such health-related themes to Uncle Rajiv at 800-CNC3. Let's have a look at this evening's Kiddies capsule.
Diabetes happens when your body builds up a resistance to insulin or simply cannot produce enough. Causes may be due to lack of exercise, poor diet, obesity, or just genetics. Symptoms include frequent urination, thirst, tiredness, blurred vision, and slow healing wounds. Now, this can all be prevented by exercising regularly, eating healthy, and maintaining a healthy body weight. Gestational diabetes, on the other hand, develops during pregnancy when hormones block insulin. Research shows that it is caused by pregnancy hormones and being overweight, or by just having a family history of diabetes. The symptoms are all of the same as the above, and it can be prevented by the same: eating healthy, exercising regularly, and managing your blood glucose levels. I'm Abigail Prudhomme of Circle Girls Hindu College, and this is your Kiddies capsule.
Good evening. November 14th is recognized as World Diabetes Day. Diabetes is prevalent in Trinidad and Tobago with an estimated adult population prevalence of 12.4 to 15%. This country faces a significant burden from the disease, particularly type 2 diabetes, which is also increasingly seen in children and is a leading cause of complications like blindness. Management strategies involve a combination of medication and healthy lifestyle choices, such as diet and exercise, and community support. If you or anyone you know suffers from diabetes, these three organizations may be of help to you. 1. The Diabetes Association of Trinidad and Tobago. This organization provides forums for discussing problems and promoting awareness of diabetes. 2. The Ministry of Health offers resources and wellness tips for managing diabetes. And 3. The Caribbean Public Health Agency, or CAPA, which works with member states to promote access to care and improve outcomes for persons with diabetes. My name is Sifira Samaru from Saraswati Girls Hindu College, and this is your Kiddies capsule.
Good evening. Let's talk type 1 diabetes. Type 1 diabetes is an autoimmune disease where the body's immune system attacks the insulin-producing cells in the pancreas. Because of that, the body cannot make insulin. Therefore, glucose builds up in the blood. Research found that it is mainly caused by genetic factors, autoimmune reactions, and sometimes viral infections. Some symptoms may include frequent urination, extreme thirst, sudden weight loss, fatigue, and blurry vision. Sadly, it cannot really be prevented since it's autoimmune. However, early detection and good blood sugar control can help to manage it. So if you find yourself having any of these symptoms, please seek advice from medical professionals as soon as possible. My name is Anjali Kanhai from Saraswati Girls Hindu College, and this is your Kiddies Capsule.
Hello, my name is Vincent and I attend Specialist Learning Center. Today, I want to tell you how to stay strong and healthy. Eat healthy. Try to have a balanced diet, making sure you include your fruits and veggies. Stay hydrated. Drink lots of water. Get rest. Get sufficient sleep to help focus during the day. Exercise. Include some exercise in your daily routine. Don't forget personal hygiene. Keep the germs away. Brush your teeth, wash your hands, and keep the body clean. Taking care of yourself helps you feel great inside and out. That was your Kiddies Capsule. Have a great night.
Hi, my name is Naya and I attend Dunross Prep. You know your body is like a car. It needs the right fuel to go. So try to eat fruits, vegetables, and other healthy things around the earth. It will help you grow strong too. And don't forget to drink lots of water. It's like oil for your engine. Can you believe that? It keeps everything running smoothly. Oh, and one more thing. Move your body. Run, dance, play outside. Everything, those things will help you get energy and help you feel happy. This is your Kiddies Capsule. Have a good night and sleep tight.
What a treasure trove of information, all geared towards healthy lifestyles on this special diabetes-themed episode. It's time for a short break, and when we return, the Medical Minds segment awaits.
I have been shopping at Price Club from the beginning. I love most of all the friendliness of the staff.
I shop there because my children love me and I love them.
My favorite section is the vegetarian section. They have such a wide variety, which I love.
I have been out shopping, to check out the prices, but here at the Lewis, it's the best.
I have tried other places and I came right back to Price Club because they are the low price leader.
Seeing her succeed makes me proud, and I know I made the right choice by giving her Enfagrow since she was little. Knowing that 85% of brain growth will occur by age 3, Enfagrow's blend of ingredients such as DHA helps support your toddler's brain development and contains 22 nutrients to support their diet or nutrition. Enfagrow, what you do today will last forever. This product is not intended to be a substitute or complement to breast milk.
Considering a career in procurement or supply chain? Start the Chartered Institute of Procurement and Supply, CIPS, program at CTS College. CIPS is internationally recognized as the leading professional accreditation for procurement and supply chain professionals. It covers industry-related topics like strategic sourcing, contract management, and ethical practices. With 1 day of class per week and 6 intake periods, students can get certified in as little as 6 months. Contact CTS College today and ask about our flexible payment options and how you can get up to $2,700 off.
Get a loan at Bremont. The process is simple. Fast and efficient approvals. Receive funds within 24 hours once approved. And no penalty for early repayment. Located at 4 Gallo Street, Woodbrook. Remember, we like to lend.
Welcome back to your #1 show for news, views and interviews of all things medical. Let us meet a physician this evening whose very name has become synonymous with excellence, with empathy and innovation in diabetes care. Dr. Sanjay Kalra from India is a prolific researcher who has written hundreds of scientific papers, mentored countless young doctors, and continues to remind us that managing diabetes is not only about controlling sugar, it's about restoring dignity, balance, and well-being. We are honored to welcome the doyen of diabetes, a global leader and compassionate healer, and a true friend of the Caribbean, Dr. Sanjay Kalra, on this evening's Medical Minds.
Good day, friends. Warm greetings from India. On the 14th of November in India, we celebrate Children's Day because it's Jawaharlal Nehru's birthday. But across the world, we celebrate World Diabetes Day. World Diabetes Day is important this year because we are celebrating diabetes in the workplace. But then you'll ask, why celebration? Is diabetes something to celebrate about? And is work something to be celebrated? But the answer is yes. Yes for both of them. The workplace is where we spend roughly 1/3 of our entire day and perhaps 1/2 of our working day. Whether you're working on the farms, in a shop, or in a factory or an office. This is a major part, a major chunk of your life. And we can use the workplace to improve our health, to prevent diabetes, to manage diabetes. So let's see how we can do that. When you're traveling to work, suppose you're going by bus, wiggle your toes, wiggle your fingers, exercise, do whatever you can. And if you're happy and you know it, what do? So clap your hands and stomp your feet. So do that whenever you are traveling. If you're stuck at a traffic light, don't get irritated, don't get angry, just meditate and perhaps do a little bit of shoulder exercises like this and see how you feel all that stress going away. When you go to work, take something that we call exercise snacks. Every 20 minutes, take a break for 20 seconds. Every 1 hour, take a break for 1 minute. And every 3 hours, take a 3-minute break. Exercise, dance, do the Zumba, do whatever dance you love. If you begin dancing, this becomes infectious, it becomes contagious. And the guy next to you, the lovely lady next to you at the next seat, she will also become happy. She'll start laughing, she'll start dancing. And see now you spread from cheer. So now you see, we can use the workplace to spread good health, good cheer, to prevent and manage diabetes. So this is an opportunity. An opportunity we must not miss. Unfortunately, what happens is our workplaces are not very well designed. The term that uses ergonomics. Ergonomics means designing the workplace in a way such that our physical health, our mental health, and social health is optimized. So, like we said, unfortunately, this always doesn't happen. The solution is endocrine ergonomics. Endocrine ergonomics means you create changes in your workplace. Use healthy furniture. Stand wherever possible. Walk wherever possible. Be friends with the people next to you. Try to create a happy social environment. And you will find that one by one, these changes will impact your metabolic health. Like we said, we will help you not only prevent and manage your own diabetes, but also prevent and manage diabetes in the people around you, in our community. What do we want for the future? We want a happy, a healthy, a harmonious Trinidad and Tobago. A happy, a healthy and harmonious world. So let's begin with ourselves. Let's be the change. Let's be healthy. And let's begin with our workplace. Jai Trinidad Tobago, Jai Health.
And we say once more special thank you to Dr. Sanjay Kalra. You know the drill, one question, one right answer, and you could be our next lucky winner. Healthy joints, a happy heart, and prizes you love. The giveaway segment is coming up next.
Period nights don't have to look like this. Move less, wake up to change. So change for a real night's sleep with Always Overnight. Its 3 times protection system absorbs, locks the fluid, and keeps it away from your skin. For protected nights without leaks. Always.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry. Premier insurance coverage for less.
Food Basket. Food Basket, nation's #1 supermarket, bakery, restaurant, meat market, fresh producers, everything fantastic. For everyday low price, things real nice. Come in once, but to come back twice. Wholesale, retail, everything for you. A real much wanna shop for go view. Food Basket, the nation's #1 supermarket, bakery, restaurant, meat market, fresh producers, everything fantastic. Food Basket, marketplace Shaguanas, where shopping is a pleasure and the price is right.
Welcome back to CNC3's Ask the Doctor. We're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. It's giveaway time with the compliments of Great Health Works. A special hello to Joseph Sandel and the rest of his superb team. Our question this evening is linked to one of the organs affected by diabetes. You know, it's World Diabetes Day on November 14th. That day is chosen because it marks the birthday of Frederick Banting and his Nobel Prize-winning discovery of insulin more than 100 years ago. So with the compliments of Neela, she sent this question in. Which part of the eye responsible for sharp central vision can swell due to diabetes? So the part of the eye responsible for sharp central vision, and there may be swelling due to diabetes. Hello, good evening, and welcome to our show.
Good evening.
Thank you for joining us, ma'am. Welcome to our Ask the Doctor family. So what part of the eye can swell? And sometimes it's treated with various injections. The eye specialist ophthalmologist will want to work in conjunction with the diabetes doctor or primary care physician to ensure that your sugar levels and blood pressure are under tight control. Hello? It sounds like we lost that caller, so the number's on the screen. Just a reminder that when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. Hello, welcome to Ask the Doctor. Good evening. Hello? Hello? So once more, as part of our special diabetes-themed episode, we're talking about that part of the eye that may be affected due to uncontrolled diabetes, treated by the ophthalmologist in a variety of ways. Good evening. Hello. Thank you for joining us on Ask the Doctor. Yes, ma'am. Go right ahead. We're hearing you.
Is the answer the optic nerve?
The nerves are sometimes affected, but I want to give you another chance. There's a specific area that becomes swollen, and due to diabetes, a specific part of the back of the eye. So when you go for that dilated exam, the doctor puts in drops and uses a special device called a slit lamp. So it's not just to check for glasses. This is an ophthalmologist, an eye surgeon examining the eyes and sometimes treated in various ways. I'll give you a hint. It starts with the letter M.
Macula?
Pardon me?
Is it the macula?
Indeed, it is the macula. Congratulations. So the reason is that I know that some of the persons would find it a little trickier. But the macula, that part of the eye is involved with edema, is one of the complications due to uncontrolled diabetes. Congratulations. You're a winner.
Thank you. Thank you.
Have you tried these supplements before?
Sure.
Yes, and
Omega XL and Omega Turmeric.
What has been your experience thus far?
Good. It has reduced joint pains and other inflammatory responses.
Well, I'm sure that our sponsors would be pleased to hear, and we'd want you to stay on the line because we want to take some personal information off the air.
Thank you.
Kudos and blessings to you and your family, ma'am. And it's time for us to take a short break because the open forum with more of your questions and hopefully answers will be coming up next.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488, 701-6680, 728-6786, or visit our website to order.
Are you tired of the same old boring drive home from work?
Look no further.
Get ready for the ultimate after-work rush with Freedom 106.5 FM's The Overdrive with Davey. Mondays to Fridays from 3 p.m. to 6 p.m. Let Davey take you on a thrilling ride of non-stop entertainment and education. He covers the topics of the day, delves into the latest food and lifestyle trends, and brings dynamic guests from exciting professions to share their professional stories and experiences. Take advantage of this energizing and engaging experience. Tune into Freedom 106.5 FM, Mondays to Fridays, 3 p.m. to 6 p.m. for The Overdrive with Davey, the ultimate way to end your day with a bang.
Welcome back to CNC3's Ask the Doctor. It's the open forum, and we'd love to hear from you with questions of a medical nature. When you're patched into the studio, listen on your telephone rather than the TV set. Always say you don't want to miss a second of your favorite program. I've been told that people mark this day and time, Thursday night. They must be tuned in. And if by chance there are persons out there, and I was so pleased and thrilled to hear, that actually look at the replay on Friday or Saturday, despite the fact that they've been locked in on a Thursday. So love and blessings, good evening, and welcome to our show.
Good afternoon, Doctor.
Thank you for joining us, ma'am. South Trinidad is in the house. Good evening.
Yes, Doctor. What causes belching? Every minute I find a bit being belching and belching. What causes that?
Thank you very much for taking the time to call in, because it may vary from one person to the next. So one size doesn't fit all, but it usually involves the body getting rid of excess gas, in this case from the mouth. And it may be linked to certain changes in diet. Some people may find that foods such as peas, beans, some vegetables like cabbage, cauliflower, broccoli may worsen symptoms. However, it may also portend other problems, including stones in the gallbladder. So the gallbladder is located in the right part of the tummy, but the upper part, and it's used to store bile that is produced in the liver. So bile is involved with the digestion of fat. And sometimes there may be gallstones that may be associated with pain to the upper part of the tummy, nausea, vomiting, sweating, and occasional infections to the gallbladder that may require surgical intervention. And belching or the body trying to get rid of gas may be one of the symptoms. So you may want to have a chat with your doctor while amending the diet. Sometimes belching may portend problems such as bacterial changes. Persons may find that they may pass gas from the rectal area, but the anorectal area, and that may also be one of the symptoms. So it's particularly tricky to pinpoint. If you find that you eat rapidly, there may be changes to your meal pattern. If you're missing meals, skipping, you may find that there is an increased incidence or risk of having this problem. It may be annoying and particularly embarrassing for certain people. Have a chat with your doctor and even consider doing some basic blood investigations. And I mentioned an ultrasound of the tummy if you want to exclude some other issues that may be underlying. Thank you very much for taking the time to call in, because some simple changes to how you eat and even to your diet may actually alleviate this embarrassing and potentially annoying symptom. Our next caller hails from Mount Hope. Good evening and welcome to our show.
Good afternoon, pleasant night.
Same to you, sir, and thank you for joining us on the Open Forum.
My excuse is lightheadedness.
Yes.
Sometimes you're lying and it just twists and you feel lightheaded, just like that for a few seconds and it disappears. Whatever. However, I went to the doctor and they're probably thinking it's vertigo.
Vertigo.
But they said the air was pretty clean. So I don't know, but it's still happening. So probably you could give me some sort of recommendation as to what to do. Thank you.
You're most welcome, and thank you for taking the time to call in. And it's a fascinating question about persons who may feel a worsening in their symptoms when they change the position of their head. So if you look left or right, if you're bent to pick up an object, you may find that that sensation of the room spinning becomes worse. And that's classic vertigo, and it's been shortened to BPPV, benign, positional, paroxysmal vertigo, in that it tends to come in waves and usually may be exacerbated by changes in position. Now, all cases of dizziness are not due to vertigo. It might be common and relatively innocuous. When we look inside the air, we see up to the eardrum. We're looking for wax, changes to the air canal, and perhaps signs of infection. So within the inner air, there may be calcium crystals that float and are involved with maintenance of balance, and sometimes these get shifted out of place. It would be difficult to actually see these crystals on the basis of a normal clinical exam. Your doctor may want to consider doing some special maneuvers in which there are changes to the position of your head. And if you may want to Google on YouTube, these are called Hall-Pike or the Epley maneuver that may confirm that, particularly if your symptoms are worse on one side. So I'm not attempting to make a diagnosis by any means on the basis of a telephone call. Your doctor would also want to check your lying and standing blood pressures, and with a full clinical examination with a heart, your pulse, and consider some basic blood investigations. We sometimes go further and do some cardiac testing involving the electrical activity, known as an ECG or electrocardiogram. And if your symptoms are not improving, we even refer to a neurologist if we believe that the brain is involved. Some persons do a scan of the brain, and even an ear, nose, and throat specialist. There are some remedies apart from those moves which I discussed. The Epley that may help with symptoms. Some of the drugs are available to liaise with your pharmacist, and they actually help with symptoms short term. You'd want to examine your medications for blood sugar, blood pressure control, and as I mentioned, a full clinical examination to determine whether benign positional paroxysmal vertigo, or when you're Googling BPPV, may be one of the reasons for your symptoms. So there are simple drugs which are available, but as we see, sometimes the diagnosis is particularly difficult. So it could represent what I say a clinical conundrum. It's a bit of a puzzle to actually narrow in. So some of the moves based on the clinical examination, and then your primary care doctor may decide whether you need to see a different specialist, do some basic investigations. The ears, nose, and throat doctor would be particularly interested. But having the basic clinical exam, it's sometimes difficult to exclude vertigo because we see the external air and up to the eardrum, the middle air, but sometimes changes to the inner aspects would not be determined as part of a routine encounter with your doctor. Our next caller hails from Princestown. Good evening and welcome to our show.
Good evening, Doctor.
Thank you for joining us, sir.
Thank you. Doctor, I want to ask a question and then I want to make a statement.
Certainly.
Okay. My question is, what is the difference with the insulin 70-30 and the N and R? You know, some patients are given the 70-30. Some patients are given the N and R, and they are taking in varying amounts.
Yes.
So could you explain to me what is the difference in that insulin?
Yes.
And my second statement is, again, I want to highlight through your program that the eye clinic at the San Fernando General Hospital is overworked.
Yes.
The doctors there is doing a fantastic job, but there are only 3 doctors, and they have to see 210 patients in one day.
Wow.
That is difficult for them.
Yes.
The nurses and the health workers, they are doing a fantastic job.
Thank you.
But we do need some more doctors in the eye clinic because they can't handle all of that. You're talking about one doctor to 70 patients in one day. That is difficult for them. So I would hope that the administration or you through your good office could highlight this to them. And this is an ongoing thing from Monday to Friday at the San Fernando General Hospital. So if they increase the number of doctors there, it could alleviate the problem. But the doctors there, they are doing a fantastic job. I will listen to you off the air on my question with the insulin. Thank you, doctor, and you have a good night and a good week ahead.
You're most welcome, and same to you and your wonderful family in Princestown. So, and thank you for shining the spotlight on yet another problem. It has been a bugbear because we often hear about persons saying that they have lengthy waiting times in many clinics through the public sector, and indeed increasing not just the number of doctors, but also the auxiliary staff, and ensuring that appropriate medications are available for our patients would be some of the targets for the rest of 2025 and into the new year. And of course, the quality of care will suffer if 3 doctors are expected to deliver and examine. We discussed about the macula, but there are so many other changes that occur due to diabetes, hypertension, and indeed genetic problems. There are persons who have long waiting lists when we're speaking about not just the eyes, but all these surgical problems. So the standard of care may suffer if there are only 3 physicians employed in such a clinic. So thank you once more. And I know that quality control and indeed all the board members will be looking to enhance the standard that would be delivered not just in the Southwest region, but throughout the country. Your question on insulin is a fascinating one. Can you believe 100 years later we have persons who don't have a refrigerator? So I've had a patient at that hospital who did not have a fridge, had to actually have his insulin administered by a neighbor. He kept his insulin in a fridge. In 2025, we have this happening, yes. And the forms of insulin available on CDAP are 70-30, so it's a mixed form of insulin, and you have N and R. So these are forms of insulin which are branded. They're excellent, used to control blood sugars, and of course try to attain a hemoglobin A1C of under 7 for most of the population. And if you're a young individual with a longer life expectancy, you may want to get even tighter control of your A1C to under 6.5% to protect your eyes, kidneys, nerves, and create a legacy of a longer life. So it's all about the duration of action. It's a mixed form of insulin when we're talking 70-30, a short-acting and medium-acting. It's cloudy. It may be administered twice per day, a half an hour before breakfast or dinner. And these will peak at various times. The value of the NNR is that they seem to mimic the function of the pancreas a bit better. In terms of N being a medium-acting insulin, it may be administered perhaps morning and evening, and R is rapid-acting, regular insulin that would be given at meal times, but of course administered for perhaps 4 to 5 injections per day, and that sometimes is not acceptable to persons beginning insulin. So sometimes if you are now starting insulin and your hemoglobin A1C is high, your doctor may want to leave you on certain tablets and then add insulin perhaps on an evening, such as N, which is medium acting, or there is a long acting insulin that used to be available in the public sector and is no longer, called Glargine, and it's time that we start changing some of those formulations that will mimic a normally functioning pancreas. So that's a bugbear for me. It's an issue, particularly in persons with type 1 diabetes that require not just frequent injections, but also require a continuous glucose monitor to avoid these frequent finger sticks that are so essential to give the doctor an idea and patient an idea on their blood glucose control. So the simple answer to your question, the formulations vary according to the duration of action, when these insulins are going to peak. The medium acting and short acting mixed into one for 70-30. The N is medium acting and R rapid acting. And if you're on that regime, you may require, apart from more monitoring, also more frequent injections. Our next caller hails from Arima. Good evening and welcome to our show.
Good evening, Dr. Tillotson, to you and your team.
Thank you, ma'am.
I want to say an experience that I've had the months of another client. Just said Venus wild line. But I first want to say to you, I'm glad to see you recovering from your flu-like symptoms.
Thank you.
Okay, the question about being dizzy while lying down. Yes. My experience is the flu is March last 24 and March 25 this year. And was feeling dizzy. I so up. It's a flu-like symptom.
Yes.
And I do have problems with hypertension, and I notice I have pain or fever. It tends to increase it when I test my pressure. Yes. Goes up. So could it be that it might have been the fever making me feel so dizzy while lying down? Because when I put my phone on my head and drink water, it passed. And it doesn't happen often. It was only when I seem to have had those fevers going into flu-like symptoms as a week or so passed.
Yes.
So do you think it could be because of the fever, or do you think I should also check my ears for that same thing you were talking about?
Vertigo.
Thanks very much.
You're most welcome, and thank you for taking the time to call in. And it's a very insightful observation, because some people, particularly after viral illnesses, may find that they also have symptoms of dizziness. So the inner air may become inflamed. So there is a medical term called labyrinthitis, viral in origin, and the symptoms are very similar to vertigo. And occasionally, may be managed in the same way. Some of those remedies which are available over the counter. Now, once more, you would want to ensure that your blood pressure is not having dips, particularly if you're dehydrated in the throes of an illness. There may be changes to your pulse if you're having, so if you're having spikes in your blood pressure, many people may have subtle symptoms. Of course, we know that it's a silent killer, but people often say that if they get a spike, they're often aware, and when they test, it's elevated. So a viral labyrinthitis is sometimes common, and you may want to have a chat with your primary care doctor and even consider a referral to an ENT specialist. Of course, middle ear infections may be sequelae of certain viruses. COVID is about, we know, influenza, and there is another virus called RSV. It's surging. On our last program, we said that COVID is very much present, and avoiding closed, crowded, close contact settings, particularly if you're traveled, would be useful. Consider wearing a mask. So fluids, rest, paracetamol, and tender loving care would improve symptoms in most people. Your point is superb that it could be an impact of the virus. Perhaps vertigo may be lurking in the background, but you'd want to be careful, because spikes in blood pressure were described after COVID, and indeed rises in blood sugar because of physiological changes to the body, and they may be temporary in some people. So have a chat with your primary care doctor to decide whether some basic investigations which I elucidated from that caller may be warranted if the symptoms persist. Wow, what a program this evening. I always say that parting is such sweet sorrow. And our closing quote is from John Bunyan. You might know his classic, A Pilgrim's Progress. But you have not lived today until you have done something for someone who can never repay you. I thought that this was a beautiful quote for World Kindness Day on November 13th, because it captures the essence of selfless service. It reminds us that true living is not measured by wealth or achievements. True living is measured by compassion, by the quiet, generous acts we do for others without expecting anything in return. Thank you for trusting me to walk beside you each week, in your homes and in your hearts. To my brilliant team behind the lens, to the transcendent Neela and baby Daniel, and to you, our viewers, stay strong, stay curious, and never stop choosing kindness. Until next time, may God bless you and keep you in his care. We'll see you then on Ask the Doctor.